Welcome back. Even the most cautious of public health experts are now saying we're turning the corner in the coronavirus pandemic. There were days last week when Los Angeles, once overwhelmed with cases, reported no new deaths. New York and Chicago are planning to fully reopen in the coming weeks. The 7-day average of new cases is at 43,000. That's down from 260,000 plus in January.
Clearly, one of the most important things is proper ventilation, and number two, mask wearing.
So what is this? Okay, let's get to mask wearing, because this is where, at what point can we stop wearing masks outside? At what point, if vaccinated people get together, do you take the masks off? And are we going to, but is the mask going to be something we have with us in a seasonal aspect?
You know, that's quite possible. I think people have gotten used to the fact that wearing masks, clearly, if you look at the data, diminishes respiratory diseases. We've had practically a non-existent flu season this year merely because people were doing the kinds of public health things that were directed predominantly against COVID-19. The Australians during their winter, same thing. They had almost no flu, largely due to the kinds of things, including mask wearing. So it is conceivable that as we go on a year or two or more from now, that during certain seasonal periods, when you have respiratory-borne viruses like the flu, people might actually elect to wear masks to diminish the likelihood that you'll spread these respiratory-borne diseases.
You know, about a year ago at this point in time, there was some chatter that, okay, maybe we just went through the worst. Summer was coming, and you'd have some people warn, look, even if things are die down now, we're going to have a rough fall and winter, which of course is what we had. Now here we are a year later. What is the likelihood we could have a rough fall, or are we looking at molehills no matter how bad things get?
Well, the fact that we have vaccines right now, Chuck, is really a game changer. I mean, if we get, which we will, to the goals that the president has established, namely if we get 70% of the people vaccinated by the 4th of July, namely one single dose, and even more thereafter. You may see blips, but if we handle them well, it is unlikely that you'll see the kind of surge that we saw in the late fall and the early winter. That's the reason, Chuck, why we plead with people to get vaccinated, because the larger proportion of the population that's vaccinated, the less likelihood that in a season like the coming fall or winter, you're going to see a significant surge. There's no doubt about that. That's the reason why vaccinations are so important. That's the wild card that we have now that we didn't have last fall or last winter.
The president set wanting 70% of the population vaccinated by July 4th. That seemed like a very easy bar to meet, considering we're about to open up vaccines for 12 to 15-year-olds. Was that intentional? I mean, are we just not going to be able to get to 80%? Is that why we can't set the bar higher? Are we sort of baking in a 25 to 30% vaccine hesitancy in this country?
No, Chuck, you know what we do? You set a goal the way the president has set. That doesn't mean you want to stop there. That means if you can, you want to do more. It was the same thing with the goal of getting 100 million people vaccinated in the first 100 days, and we wound up getting 220 million people vaccinated in the first 100 days. So you set a goal. I think it's a reasonable goal. I believe we'll get there. But, you know, as you get less and less people in the cohort of unvaccinated, it becomes more difficult to get them. When you have a large cohort of unvaccinated people, then you get your 3 to 4 million people per day. Right now, we're averaging about 2 million a day. So if we do that, which I think we will, I believe strongly that we will reach the president's goal of 70% of adults getting at least one shot by 4th of July.
All right. Anybody that, at this point, anybody that trusts you, trusts the government, trusts us in the media, has gotten a vaccine. I think it's safe to assume those that haven't have some trust issues. Maybe it's trust with the medical community, maybe it's trust with government, maybe it's trust with us in the media. So what kind of strategies do you think are necessary to get us up to that 80, 85%? I mean, we're seeing financial coercion. Is that the way to go? Are mandates the way to go? What is the strategy going forward?
I think it's twofold, Chuck. One, you've got to get trusted messengers out there getting people to understand why it's important to get vaccinated for themselves, their family, and the community. And, you know, different types of people in different phases in life have different trusted messengers. It could be sports figures, it could be entertainment figures, it could be clergy, or it could be your family doctor. That's the first thing, trusted messengers. The next thing is make it as easy as possible for people to get vaccinated, which we're doing now with the 40,000 pharmacies where you don't have to go online, you don't have to call up, you can just walk right in a walk-in and get vaccinated. Mobile units to go out into not easily accessible areas. So I think those two are the major ways that we can get that last group of people who seem to be recalcitrant, to get them to understand why it's so important to get vaccinated.
We got a new analysis from the University of Washington that indicates more than 900,000 Americans have died from this virus. So it's almost double what we were able to track. Just your overall reaction and what does this tell you about our ability to sort of track this virus that we may have undercounted by almost 50%?
You know, we've been saying, and the CDC has been saying all along, that it is very likely that we're undercounting. You know, the model says that it's a significant amount, as you mentioned correctly, 900,000. That's a bit more than I would have thought the undercounting was. But, you know, sometimes the models are right on line, sometimes they're a bit off. But I think there's no doubt, Chuck, that we are and have been undercounting. What that tells us is something that we've known. You know, we're living through a historic pandemic, the likes of which we haven't seen in over 100 years.
That's true, and it looks like these numbers are going to make even 1918 look a bit smaller than what we dealt with now. Dr. Anthony Fauci, as always, sir, appreciate you coming on and sharing your expertise and perspective.
Thank you.